At Prevent Blindness, we promote healthy vision and access to eye care for all. We educate people about protecting their sight. We advocate for strong vision policies at the local, state, national, and global levels. We empower the blind and low vision community and their allies, and we celebrate their achievements. Here's your host, Christopher Hord.
Greetings, my name is Christopher Hord, and I'm your host for the Focus on Eye Health podcast. Welcome to our premiere episode. During the course of the season, you'll learn more about Prevent Blindness, its mission, its history, and what's coming next. You'll also get information about vision care, eye health, and eye safety. Additionally, you will meet members of the blind and low vision community and their allies and celebrate the work they do. This episode features news about the organization and announcements about upcoming events. Prevent Blindness leader Todd talks about plans for the coming year. We'll also feature a musical performance by a talented singer, songwriter, and musician, Jason Constellation, who is part of the blind and low vision community.
News.
Prevent Blindness declares March as Workplace Eye Wellness Month. According to the U.S. Department of Labor, nearly 20,000 people have serious workplace eye injuries every year. Hundreds of thousands of people suffer issues such as eye strain. Many of these problems are preventable. That is why Prevent Blindness is declaring March Workplace Eye Wellness Month. Some people work with tools or machinery that can break, or materials that might produce shards, splinters, or other particles. In such locations, it's important to wear protective eye gear. Make sure your eye gear meets the standards set by the American National Standards Institute. In contrast, many office workers spend much of their day staring at computer monitors, tablets, and cell phones. For them, eye strain can be a serious issue. For office workers, try to place your monitor about 26 inches from your eyes. Additionally, try adjusting the lighting in your office to reduce glare. Visit our website at preventblindness.org for more information on how to prevent eye injuries and reduce eye strain, or look for the link in our show notes at your podcast provider.
Feature presentation.
To start off, please tell us your name and what you do.
My name is Todd. I'm president and CEO at Prevent Blindness. I've been here for about 20 years now, going on 22. As CEO, I have my hands in a little bit of everything here at the organization, from fundraising to, supporting our program team, our public health and policy team, the work we do in Washington, and just, our whole purpose is to support and empower increased access and eye care in this country. It's a great organization. I'm happy to be a part of it.
Okay, thank you. Now, can you tell us a little bit about, blindness and low vision is something that affects many people's lives, even other than the people who are personally subjected to it. Can you tell us a little bit about your own journey and how it led you to come to Prevent Blindness?
Yeah, I'll tell you I came to Prevent Blindness kind of happenstance. I've always worked in public health. So yeah, Chris, my journey to get to Prevent Blindness was a bit happenstance. I've always worked in public health, and I was working out in Washington, D.C. for a while, and it was around 9/11 and a lot going on in the country. And I had an interest in coming back to the Midwest, which is where I was from. And this position at Prevent Blindness just kind of jumped in front of me, and I interviewed with them and joined the team soon thereafter, which brought me to Chicago, where I've been ever since. But I do have a connection with blindness and low vision that um, it's been very personal for me and something that I reflect on a lot through my work. My grandmother, several years ago, lost her sight. And, we talk a lot about one of the challenges in raising support around vision and eye health compared to other healthcare conditions is that it's not, they say it's not life threatening, that people don't die from it, such as like cancer or heart disease, etc. But my grandmother suffered with AMD, and she was always a very cheerful, happy person. And I think I was around 20 or something, and I remember she got macular degeneration and very quickly lost her sight, and she fell into a deep depression that frankly she never came out of. And I know for a fact that it's what ended her life. So you can't tell me that there aren't fatal conclusions to this. And I reflect a lot that if we had back then, or if we were aware of back then, the many resources that she could have been provided, that her life may have changed, may have turned out differently. And so I think about that a lot, that there's so many resources available for people who are blind or who have low vision. And I think we just need to do a better job of educating patients and families that those are out there and connecting them to that care.
Okay. And that brings us actually neatly around to the next thing that I wanted to ask. And that is, first of all, for a lot of people, this may be their first time encountering prevent blindness or what it does. Could you give us just a little background on it and tell us a little bit about the current mission?
Absolutely. Yeah, I mean, a lot of people may not know us, but we've been around for a very long time. We've been around for 117 years. We were founded in 1908 as really, that was a time when public health was just emerging in the US. It was around the turn of the century. And back then, healthcare in general was basically what you received in the doctor's offices or in hospitals. And there were a group of people that we were founded in New York City. There were a group of people back then that realized that they needed to go out into the communities and out into the streets to deliver healthcare in general. This was largely due to a large immigrant population in New York. But at the same time, there was a condition that was rampant across the U.S. Children were being born were born and soon after went blind due to a condition that was treatable. They essentially caught a condition, a venereal disease, essentially going through the birth canal. And there was a treatment that was available as early as the late 1800s. But as we know in public health, just because there's a treatment doesn't mean that people are getting that. And
Yeah.
so a number of advocates came together in in the early 1900s and went state by state advocating for public policy to require the simple treatment. It's a drop of antibiotics in a baby's eyes soon after they're born. And it essentially eradicated this form of infant blindness back then. Since then, we have grown to pretty much be all things eye health. Our mission today focuses on all eye conditions, all ages, birth to death. We focus primarily around education awareness, educating folks about the importance of eye health, about various eye conditions. Public policy, we're working to advance public policy that supports eye health access. And then the third is really engaging patients and care partners to be partners with us in advocating for eye health and ensuring that systems of care are in place to support a strong eye health system within the US and beyond.
Okay. Now, those areas that you talked about, the public policy, for instance, the work with the medical community and scientific researchers, but also work with the blind and low vision community, that covers a lot of areas. Can you tell me a little bit about what kind of, I hate to use the buzzword synergy, but the way these different aspects sort of affect each other and how it relates to prevent blindness, how it operates as a whole.
Absolutely. Yeah. One of the programs that we're really proud of, it's called Aspect, our Aspect Patient Engagement Program. And we've been able to leverage that in many ways. But one way, well, it's essentially a training program where we bring patients and care partners together to equip them to tell their stories and to be advocates. But one area that we bring that to bear in is in eye health research. We're lucky right now that there's an incredible amount of research for treatments for various eye conditions, but we really emphasize the importance of engaging patients and the patient voice as early as we can in research. It's fine if a pharmaceutical company or another group enters into research, but they need to understand the impact of that on the patients that they're trying to reach. So whether that's bringing patients to help pharmaceutical companies in designing their clinical trials or understanding how to market drugs to the community that they're serving, we're able to bring patients. And so we're playing an active role in the research process. And then on the other end of that, we are advocate. We're in Washington D.C. often. Our staff is our volunteers and the patients that we work with to advocate for public policy. And there's clearly a connection there between the work that we do on the research side and the policy side. And then in the middle is training folks to be vision screeners or to help patients access care. We are a tremendously resourced country, and yet there are so many people in this country who don't have access even to get a simple pair of glasses, much less low vision resources. And so there's a lot of work to be done to identify those people who are uninsured, underinsured, or who lack access for many reasons and get them the care that they need.
Okay. Now, and I should, for the interest of transparency, let our listeners know that I went through a cohort of the Aspect program. And one of the things I was very struck by, in addition to, just becoming my ability to become more part of the blind and low vision community, was members of the cohort who were ophthalmologists or who were medical students who were really emphasizing wanting to be better able to understand what their patients were going through.
Absolutely. And we were so pleased to have you as a part of the Aspect family, Chris.
Oh, thank you. Now, I guess the other main thing that people might be interested in finding out, since it is the early in the year, it would be interesting to get some idea of sort of what the main focuses are as you're coming into 2025. What are there any particular initiatives or goals that you are focused on for this year?
Yeah, I'll just start by sharing a couple of interesting things that connect to your question. One is that we have been blessed with a very nice legacy gift from a woman who recently passed away, and her husband was a volunteer with us back in the 80s and 90s, and she left us several $1 million that is going to allow us to expand our capacity. And so we're spending time right now really looking at this next stage of our evolution as an organization. At the same time, we always operate under a strategic plan, and our current strategic plan is ending. So we're in the middle of a strategic planning process. And so what we're really looking at through that plan, over the course of 2025, we're going to be spending time. The biggest thing, I guess, that I'm most excited about is we're going to be doing an awareness campaign. As you said earlier, a lot of people don't know who we are, and that's a big problem. We have a lot of great resources, but if people don't know who we are or don't know where to come to access them, then they're not being utilized. And so we're going to be implementing a national awareness campaign to better educate people about who Prevent Blindness is and the many services that we have to offer. At the end of the day, almost everyone has some eye health need. Across the spectrum, and whoever you are, we want to be your partner in eye care. On top of that, we're revisiting our children's vision screening training program and really modernizing that. It's a big components of that are virtual. It's a virtual program, and so we're spending some resources and time and staff energy into taking a look at that and making sure it's really modernized and up to speed. So those are a couple of the big things. And then the final thing that I'd say I'm most excited about is last year we entered or we partnered with members of Congress to introduce a new piece of legislation, the Early Detection of Vision Impairment for Children Act, into Congress. Now, with the new Congress approaching, there'll be a new Congress brought on next week. We're going to be reintroducing that act, and I'm very hopeful that with the support of our many advocates, we're going to get that bill passed next year. And what it does is it will provide federal funding to states to implement vision and eye health programs. It's not really restricted to what they do. We want to leave that up to the states, but it's going to provide the first ever federal funding to states to address children's eye health. We think we can get that passed. It's been introduced in a bipartisan approach from both Republicans and Democrats, which is important right now, and we're really hopeful for that. So those are some of the big things we're working on this year.
Great. Now, one thought just dawns on me that we should touch on while we're talking. People who are listening to the podcast, which is, of course, part of Prevent Blindness outreach now, who would benefit most? What types of people would benefit most from the services you currently offer, and what's the best way for them to reach out, like website, email, telephone? What do they do?
Pretty much they can reach us. There are multiple ways, all of those you mentioned. I think the easiest way is to visit our website. It's preventblindness.org. But we are on pretty much all the social media channels. So, visit us on Twitter or X, Facebook, Instagram. We have a new YouTube presence we're excited about, and we just launched a TikTok profile. So visit us on all of those. But to your first question of who do we have resources for? It's really anybody. As I mentioned before, everyone is going to have some eye health need. So whether you're a mother who is struggling to pay for glasses for your young child and need access to get glasses so your child can see as they enter kindergarten, or you're someone who just found out that your grandparent has glaucoma and wants to understand what that is, we have information for you. If you're someone who has low vision or is blind, we have resources such as our Living Well with Low Vision website that will help you access resources to live the highest quality of life possible. We have other programs like the one you're a part of, Aspect. So there's virtually something for everybody. Everyone in this country needs to understand what they can do to protect their eye health or support their quality of life, wherever their vision is on the spectrum. And so we have resources for everybody. And again, that's preventblindness.org.
All right. And I think outside of that, I just want to check to see if there's any particular points that you wanted to raise for people that we have not touched on today.
I think I touched on it and on everything that I was interested in. And I guess I would say if anyone out there has an interest in learning more, visit the website. But if you have needs that you don't find answers for, shoot us an email from the website, and we'll get back to you and help see what we can do.
All right. Well, thank you very much for being on the program.
Special guest.
In this episode, we welcome singer, songwriter, and guitarist Jason Constellation. Jason was a fixture in the New York City club scene, but when he lost his eyesight in 2019, he had a new set of challenges. However, he continued to write and perform. You can stream Jason's music or buy it on most major services, including Apple and Amazon. Here is Jason Constellation.
Now I'm bound to life. Now I'm stuck on its course of search and strife. Of course I'm failing now. Now I'm bound to see. Now I'm bound to be the result of my ways, the result I must make in order to be free, in order to be real. I must start now. Now I see the end. Now maybe it's just another beginning, another start. Now I'm fully aware. Now I'm headed for there. There's New York, and there's where I will be. The result of my ways, provider of my days of victory, the days of you and me. Don't you dare think I forgot you in the heat of all this mess, the heat of all this stress, the heat. I will freeze over right about now. Now my sail is set. Now my sail is full. It's full of gusty winds. It's full of promise now. Now I say goodbye. Now I say hello. Hello to happiness. Hello to defiance against what held me tight, against the troubled night. No more waking up to things I'd rather be rid of, be free of now. Now.
Announcements.
Save the date. The 14th annual Prevent Blindness Focus on Eye Health Summit takes place on May 14th. This innovative online virtual conference brings together healthcare professionals, policymakers, patient advocates, researchers, technologists, and more. This year's theme is Perspectives in Vision. These innovators will collaborate to explore a multidisciplinary spectrum of vision care. The event features keynote speakers, panel presentations, a sponsor room, and breakout coffee chat sessions. Patients and patient advocates will present their stories of how blindness or low vision has affected their lives. Once again, the 2025 Focus on Eye Health Summit takes place on May 14th. Sponsorships are still available. For more information, see preventblindness.org. Do you know families experiencing barriers to accessing eye health care? If you are part of a family that is experiencing barriers to eye health care, or know of a family who is, Prevent Blindness has information that can help. One simple way that families can learn more about this issue is to view a PowerPoint presentation that Prevent Blindness prepared for an online webinar we held at the end of 2024. The presentation has been made available as a PDF document that can provide useful information on overcoming such barriers. Please check our website at preventblindness.org or check our show notes for the download link. Thanks for listening. Please join us for our next month's episode where we'll have more news, features, and announcements of interest to the blind and low vision community and those who work with them. Please subscribe to the Focus on Eye Health podcast through your favorite podcast distributor. Have comments or tips? Contact us by emailing podcast@preventblindness.org. We can't reply to every email, but we read every one. Enjoy and share.
Listen to the podcast from our website at preventblindness.org or subscribe to it on all major podcast services, including Amazon, Apple, Spotify, and YouTube. This has been your announcer, Corey M. Snow.